Hello, today we're going to discuss Chapter 27 in your text, Nutritional Therapy and Assisted Feeding. In this presentation, we will cover these three concepts: Nutritional Therapy Overview, Nasogastric Tube Overview, as well as tube feeding. This chapter should provide you with an opportunity to learn about the nurse's role in diet therapy. Topics include health issues related to nutrition and disease processes that benefit from dietary therapy. Also, assisted feeding is covered in depth, including skills for inserting a nasogastric tube, administering nasogastric or duodenal tube feedings, or feeding via PEG tube, and other procedures. Nutritional Therapy Overview. The objectives covered in this lesson 27.1 are as follows. Identify the nurse's role related to nutritional therapy and special dietary needs. Compare and contrast a full liquid with a clear liquid diet. Explain the different dietary modification levels: pureed, mechanically altered, advanced, and regular. Describe health issues related to nutrition. And list disease processes that may benefit from nutritional therapy. You will learn how to apply the following clinical practice techniques. Use therapeutic communication to assist a patient who requires a special diet, as well as develop a patient education plan for nutritional therapy. Let's begin. The goal of nutritional therapy are to treat and manage disease, prevent complications, and restore or maintain health through appropriate diet. Patients in healthcare facilities have multiple dietary needs related to disease processes, surgical procedures, physical health, cultural, religion, and individual preferences. The specific diet for each patient is prescribed on the primary care provider's orders. Some patients may have diets without restrictions that are similar to meals eaten at home. For other patients, nutritional therapy is a significant factor in their medical treatment. You can assist patients in meeting their nutritional goals by completing a thorough nutritional data collection and assessment. Monitor the patient's food and fluid intake and document the response to therapy. Some patients may need assistance with feeding. Patients who may need assistance with feeding with food and fluid intake include those patients who have paralysis of the arms, visual impairments, IV lines, or any other devices in their hand or arms, problems breathing or problems swallowing, such as dysphagia, or severe impairment or weaknesses. In Figure 27.1, in your textbook on page 485, there is a photo there of a nurse assisting a patient with feeding. You may delegate this task to a nursing assistant or a family member if appropriate. Here is that Figure 27.1 of the nurse assisting a patient with feeding. Again, this can be found in your text on page 485. Patients scheduled for surgical procedures may have special nutritional needs. Ideally, the surgical patient should be well nourished before surgery, preoperatively, to facilitate postoperative healing and recovery. Per this slide, preoperative patients usually are placed on NPO 6 to 8 hours before a procedure. According to your textbook on page 487, this status of NPO could be 12 hours before the procedure. Postoperative patients progress from a clear liquid diet to a full liquid diet. Clear liquid diets are started when the patients have a return of bowel sounds, which is detected by auscultation. Foods and progression of diet can be done slowly, from a soft diet before attempting a general or regular diet. Foods allowed on a liquid diet. So there are two types of liquid diets. One can be referred to as clear liquids and the other as full liquids. Clear liquids primarily maintain fluid homeostasis and relieves thirst. The goal is to introduce fluids that have a low residue and are easily digested and have a low risk of causing abdominal discomfort. Abdominal discomfort or distress, such as vomiting and distension, can cause injury to surgical interventions. Foods that are clear fluids at room temperature, such as gelatin and popsicles, and liquids that are clear are included on the clear liquid diet. So here on this list, there is an example of some clear fluids. Please read the list and familiarize yourself with clear liquid foods. Full liquid diet may be used as a step between clear liquid and mechanical soft or regular diet. Full liquid is used following surgery, long-term fasting, or for those with a chewing or swallowing problem. Full liquid diets include all fluids, custards, ice creams, sherbets, puddings, and cooked refined cereals. Full liquids can be used for longer-term nutritional management because protein and other essential nutrients, vitamins, and minerals are available from those foods. The full liquid diet is, however, low in iron, vitamin A, and vitamin B12, thiamine, and thiamine. Therefore, vitamins and mineral supplements must be provided for longer-term use. So, in your textbook, please see box 27.1 on page 488 for examples of foods that are allowed in the clear liquid and full liquid diet, as stated here on this slide. Postoperative patients' liquid diets, as I stated before, is usually started when the bowel sounds return. Presence or absence of bowel sounds is determined by auscultation. The goal is to have a low residue diet, which is easily digested foods. A liquid diet increases the risk of abdominal discomfort and vomiting. Patients may progress to soft diet before advancing to a regular diet. Anorexia nervosa is a psychological disorder characterized by restriction of caloric intake, a very low body weight for the developmental stage, and a pathological fear of becoming fat, and a severe disturbance in body image. It is a prevalent issue among adolescents and young women. However, adolescent and young men may also be affected. They view themselves as obese despite extremely being underweight. Patients with anorexia nervosa severely restrict caloric intake and focus on moderate to vigorous physical activities. If not corrected, anorexia nervosa can be fatal. Treatment is a combination of nutritional intervention, behavioral modifications, and psychological counseling. Bulimia. Bulimia nervosa is an eating disorder characterized by episodic binge eating, followed by behaviors designed to prevent weight gain, including purging, fasting, using laxative, and exercising excessively. Women with bulimia nervosa are aware of their problem and often feel ashamed of the behavior. Treatment of bulimia is usually easier because of this awareness. Psychological and nutritional counseling is necessary. Obesity rates continue to rise, and obesity has become a national health threat. The CDC estimates that about 34.9% or 78.6 million of adult Americans are obese. Obesity is the second leading cause of preventable death in the United States. Many factors contribute to obesity, including factors such as genetics, environment, poor eating habits, lack of knowledge about nutrition, medications, gender, and age, etc. The goal of obesity treatment is to improve health quality of life. Nutritional modifications and physical activities to manage obesity must be individualized and incorporate all factors relevant to that patient. Bariatric surgery is currently taught as the most effective treatment to provide long-lasting weight loss for patients with extreme obesity. Pregnancy. Nutritional status before and during pregnancy can influence the health of the mother and the fetus. Nutritional data collection and counseling are important throughout the pregnancy to reduce the risk for complications such as low birth weight of the infant, gestational diabetes, and pregnancy-induced hypertension. Factors to consider when counseling a pregnant woman include nutritional status before her pregnancy, her age, the number of prior pregnancies, and her BMI. An increase in nutrients is needed for healthy growth of the fetal and maternal tissues. Weight gain should be 2 to 4 pounds for the first trimester and 1 pound per week during the second trimester and the third trimester. It is recommended no caloric increase in the first trimester, then 300 calories per day for the second and third trimester. Individuals who use alcohol, smoking, and other substances present with nutritional deficits when entering healthcare facilities. Substance use interferes with food intake by decreasing appetite, decreasing financial resources for food, and substituting calories in alcohol for calories in food. Substance use may also lead to impaired absorption and reduced storage and use of nutrients, along with increased metabolic needs. Patients with a history of substance abuse should be assessed for nutritional deficits. Thiamine deficiency is often present with alcohol use. Medical treatment usually includes fluid and electrolyte replacements, vitamin and mineral supplements, especially thiamine, and a high-calorie, high-carbohydrate diet. Liver damage is common in patients with substance use because of the increased stress of the metabolizing excessive alcohol and other substances. Dietary fat should be restricted if liver function is impaired. Cardiovascular disease includes disease of blood vessels, hypertension, myocardial infarction, and heart failure. Nutritional therapy is focused on reduction of saturated and trans fat cholesterol, sodium intake, and red meats. Excessive saturated and trans fat intake leads to the development of atherosclerosis, which is the accumulation of fatty deposits on the walls of blood vessels. The blood contains 3 types of cholesterol: high density lipoprotein, which are your HDLs, also known as your good cholesterol. This tends to cleanse vessels of fatty deposits. Low-density lipoproteins, your LDLs, increases fatty deposits on the vessel walls. Your very low-density lipoproteins serves as a carrier of triglycerides in the blood. Therefore, levels should be kept low. Consumption of trans fat also increases levels of triglycerides. Increased levels of triglycerides can also signal a risk for diabetes or poor control of diabetes. Sodium. 1 teaspoon of salt contains 2,300 milligrams of sodium. Therefore, control of dietary sodium is also therapeutic in prevention and management of cardiovascular disease. Diabetes mellitus is a disturbance of the metabolism of carbohydrates and other nutrients and the use of glucose by the body. There are two types of diabetes. Type 1 diabetes occurs when the beta cells of the pancreas stop secreting insulin. Insulin is needed to transport glucose across the cell wall. Type 1 diabetes usually develops at an early stage. Type 2 diabetes accounts for about 90 to 95% of all cases of diabetes. It occurs when glucose receptors on the cell membranes lose their sensitivity to insulin. Insulin is secreted in normal or excessive amounts. However, the receptor sites do not allow most glucose to enter the cells. Although it appears primarily after age 40, type 2 diabetes is now appearing frequently in younger people, even children. Of particular concern is prevalence of type 2 diabetes among children, adolescents, and young adults. According to the American Diabetes Association, African American, Mexican Americans, American Indians, Native Hawaiian Pacific Islanders, and Asian Americans are higher risk for type 2 diabetes, heart disease, and stroke. Please look on page 491 in your text to get a thorough understanding of diabetes type 1 and type 2 and those who are a higher risk for acquiring diabetes. Patients should distribute carbohydrate intake throughout the day and avoid ingestion of large amounts of carbohydrates at one meal. Complex carbohydrates usually contain more nutrients and higher fiber content. Research suggests that fiber delays the absorption of glucose, resulting in lower glucose levels. Dietary counseling related to reducing fat and sodium in the diet should be part of the meal plan. People with diabetes are advised to reduce saturated fats less than 10% of calories, minimize trans fat, and restrict their cholesterol intake to 300 milligrams per day. A summary of the general dietary strategies are provided to you in box 27.2 in your textbook on page 492. Careful management of blood glucose levels can prevent or delay the onset of many complications. Instruct patients in ways to include favorite foods into development and into their diet and remain within their individual dietary plan. Develop the plan taking into consideration the type of diabetes, the patient's activity levels, and whether the patient is overweight. Every person with diabetes responds differently to carbohydrate intake. Patients with diabetes are at higher risk for developing cardiovascular disease, hypertension, kidney disease, blindness, and stroke. Dietary counseling is absolutely essential in preventing these diseases. HIV and AIDS. Human immunodeficiency virus, also known as HIV, and acquired immunodeficiency syndrome, AIDS, are associated with severe diarrhea, profound weight loss, and muscle wasting. Some patients lose as much as 50% of their body weight because of treatment, multiple infections, loss of appetite, malignancy, and gastrointestinal disorders. Nutritional therapy is directed towards replacing fluids and electrolytes, fostering weight gain, replacing muscle mass through protein intake, and maintaining the strength of the immune system. All right, so here we are. Question 1. For these responses, please place your response or post your response under the shared notes or in your chat box. Question 1. Diabetes mellitus is a disturbance of carbohydrate metabolism. Which two ethnic backgrounds are at greatest risk for developing diabetes? Whites and African Americans, whites and Hispanics, African Americans and Hispanics, or is it African Americans and Asians? The answer is 3. African Americans and Hispanics. The incidence of diabetes mellitus is increasing at an alarming rate in the United States. Although all ethnic backgrounds are at risk of developing diabetes, African Americans and Hispanics are at greater risk of developing this disease. Question 2. Please post your response again under Share Notes or the chat box. Bill is a recently diagnosed patient with HIV. Both Bill and his partner Pat are present for the nurse's discharge teaching regarding his diet. Which of the following is true regarding diet therapy in HIV patients? Number 1, patients should be referred to a dietitian within the first year of diagnosis. Number 2, emphasis should be made or placed on carbohydrate intake. Number 3, patients should be encouraged to eat three full meals a day. Or number 4, research suggests that dietary therapy can be a factor in delaying full-blown AIDS. The answer is 4. Research suggests that diet therapy can be a factor in delaying the onset of full-blown AIDS. HIV patients should be referred to dietitians as soon as possible. Do not wait a year after diagnosis. Emphasis should be placed on protein intake, and meals should consist of small, frequent meals instead of 3 full meals. Question 3. Again, post a response to this question under the chat box or the share notes. Gabriel's patient is admitted with a diagnosis of alcohol abuse. She is assessing her patient for any nutritional deficits. Which deficiency is often present with alcohol abuse? Number 1, niacin. 2, thiamine. 3, potassium. 4, sodium. The answer is 2. Thiamine deficiency is often present with alcohol abuse. Medical treatment often includes a diet that is high in calories and high in carbohydrates. Diets also usually include fluid and electrolyte supplements and vitamin and mineral supplements, especially thiamine. In this section, we're going to cover the content for nasogastric tube overview. The objectives covered in this section are as follows. You're going to be able to verbalize the rationale for assisted feedings and tube feedings. List the steps for the procedure to insert, irrigate, and remove an NG tube. In the clinical practice, you'll acquire the skills and be able to demonstrate insertion, irrigation, and removal of an NG tube. Nasogastric and internal tubes. There are several types of internal tubes. Please familiarize yourself with these tubes. This content can be found in your textbook, Chapter 27, page 495 and 496. Please refer to Figure 27.2 as well. Nasogastric tube placement is usually temporary and is used to provide nutritional support. The tube is placed through the nose and esophagus directly into the stomach. The nasogastric tube, also referred to as the NG tube, may be used for other purposes such as stomach decompression after surgery, obtaining laboratory specimens, gastric lavage for patients with GI bleeding, or also used for medication administration. Nursing care of patients with NG tubes involves insertion, irrigation, administration of tube feedings, and check for placement, check for residual volume, and removal of the tube. Success in inserting the tube is more likely if the patient's confidence is gained first. Check the tube placement prior to feeding or administering medications. Irrigate the tube to ensure that it is patent. These are the following reasons why NG tubes or internal tubes may be used. Individual has difficulty swallowing after a stroke, inflammatory bowel disease, again for decompression of the stomach, obtaining gastric specimens, gastric feeding, or lavage, administration of medication. Please review the skill 27-2 in your textbook regarding insertion and cure of an NG tube. This can be found on page 497. Again, figure 27-2 can be found on page 496. A PEG tube or J tube is used when a patient requires long-term nutritional support and cannot take oral nutrition. The PEG or J tube has replaced surgical gastrostomy tubes placement in most situations. The tube is placed via endoscopy. The PEG or J tube allows the patient more freedom of ambulation and allows the patient to administer his or her own feedings easily. These tubes can be removed easily when it is no longer indicated. Care of the PEG tube and J tube is similar to that of the NG tube. Check tube placement at least every shift and before feeding or administration of any medication. Question 4. Please post your response under the share notes or chat box. Sienna's patient is having difficulty swallowing. Her doctor has ordered a gastrostomy tube. Sienna explains to her patient that a gastrostomy tube is a tube placed, number 1, through the nose into the stomach, 2, directly into the stomach, 3, directly into the intestines, or 4, directly into the veins. The correct response is number 2. A gastrostomy tube is a tube placed directly into the stomach, whereas an NG tube or nasogastric tube is placed into the stomach through the nose. A J tube is a tube placed into the intestines, and an intravenous line is placed directly into the veins. Final section, tube feeding. In this lesson, 27.3, the objectives covered here would be discussing the procedures for tube feedings, identify medical rationale and nursing care for patients with receiving peripheral parenteral nutrition, also known as PPN, and total parenteral nutrition, referred to as TPN. And finally, understand the possible complications associated with modified diets, tube feedings, PPNs, and TPNs. Clinical practice objectives. You'll be able to demonstrate feeding a patient through an NG tube or percutaneous PEG tube, and also know your facility's policies, procedures, and protocols for nutrition-related problems and complications with tube feeds. Tube feedings can be continuous or intermittent. Continuous feedings is effective for patients who cannot tolerate large amounts of fluids at one time. Intermittent feedings is beneficial for patients who are able to feed themselves or when beginning to be reintroduced to oral feedings. Intermittent feedings more closely resemble regular meals. Feelings of hunger stimulates appetite and aid in the transition from tube feedings to oral feedings. The amount of tube feeding is prescribed by the physician, which can range from 8 to 12 ounces per feeding. Or in other words, 240 mLs to 360 mLs per feedings. There are several different types of feeding tubes and pumps. Plastic NG tubes can be used for lavage, tube feedings, and administering medications, whereas small bore silicone feeding tubes are usually used for only tube feedings. PEG tubes or J tubes are used for feeding and administering medications. Figure 27-3 are examples of these type of tubes. Total parental nutrition, or TPN. It is a method of delivering complete nutrition through a catheter placed in a large central vein, or subclavian vein. A large central vein with a high blood flow is needed to dilute the solution rapidly. The solution may also be infused through a port implanted in the patient's chest wall or through a peripheral inserted central catheter known as PICC line. These options are used for patients receiving long-term therapies such as those with massive burns, intestinal obstruction, inflammatory bowel disease, AIDS, and cancer or chemotherapy. For shorter-term use, a peripheral vein, usually in the arm, may be used. It is called peripheral parental nutrition in this circumstance, PPN. PPN does not involve the digestion system, and it is absorbed directly through the bloodstream. Final question, question 5. Please post your response again under the share notes or chat. As a nurse, when taking care of a patient with an NG tube, you should remember all of the following except for 1. That the tube placement should be checked at least every shift and before every feeding. 2. To elevate the head of the bed 15 degrees before feeding and leave it up for 30 minutes to 60 minutes after the feeding. Number 3. The amount of the tube feeding is prescribed by the physician. Or 4. To record the intake and output. The answer here is number 2. You elevate the head of the bed 30 to 90 degrees before feedings. You leave the head of the bed up for 30 to 60 minutes after the feedings. So all of the following except for number 2 is correct. Thank you.